Hello everyone, welcome back to SNS Park. Let's heal and learn together. I'm Yalini from SNS College of Nursing. Today we are going to see about a new topic from physiology of Sem 1. Now we are going to discuss about the important 5 marks of functions of bile. Let's go into the topic now. Bile is produced by the liver and it's stored in the gallbladder. Even though it does not contain digestive enzymes, it plays a crucial role in the digestion and many other systems. So our objectives is that at the end of this section, you will be understanding the bile and applying the knowledge of its function to analyze the clinical situations and their therapeutic application. So let's dive into the topic now. By this diagram, we can understand where is the gallbladder, pancreas and liver is associated and situated, and the right and left hepatic duct, and where is the common hepatic duct is there because the secretions and the production will be happening in the liver and stored in the gallbladder, and again will be segregated when it's necessary. So we have to know the passage. Bile has two important functions, which is related to the fat. Digestion functions consists of bile salt emulsifies the large fat globules into the small droplets. This increases the surface area so that the pancreatic lipids can easily break down the fats. And main important. And the next function is of absorption function. Bile salt helps in the formation of muscles, which carries the digestion fats and fat-soluble vitamins like A, D, E, K to the industrial walls for absorption. Clinically, if a bile is not reaching the intestine, as it's of condition like obstructive jaundice and gallstone blockages, the patient develops fatty stools and deficiency in the fat-soluble vitamins. As the nurses, we monitor for signs of bleeding, vitamin K deficiency, and bone problems like vitamin D deficiency. Bile also performs the excretory functions which excrete the bilirubin for the breakdown of hemoglobin and excessive cholesterol also, and that is of heavy metals, toxins, and some drugs. Next is of laxative actions is of bile salts stimulate the peristalsis in the intestine. Next, the important functions of antiseptic action. The bile's detergent actions inhibit the growth of certain bacteria in the gut and which helps in maintaining the gut flora balance. In clinically, we can say that the clinical practice when the bile flow is obstructed and the patients develop jaundice and dark urine and day color stools, we can say that this is of obstructed bile. And nurses plays a vital role in early detection and monitoring the liver function tests, which we can say that LFT. Bile has the alkalinic nature, which is of due to the bicarbonate content present in because it neutralizes the acidic cumin coming from the stomach and creating an optimal pH for the pancreatic enzyme to work in the small intestine. And second is of prevention of gallstone formation. Bile salts keep the cholesterol in soluble form itself, so that they're preventing the gallbladder development. Next is of lubrication. Mucin in the bile lubricate the intestine for the smooth passage of content. This is of cholesterol action. The bile salts stimulate the liver to segregate more bile, and next is of which cause the contraction of gallbladder to release the stored bile. These functions become very important after the cholecystectomy, which is a gallbladder removal. It is the most important thing. Patient may have loose stool or the fat intoxicity. We advise small and frequent low fat things can be intaken. Whatever we have seen up to this slides, this is a like a summary of what the bile contain. Bile contain the bicarbonate, salt, and bilirubin and alkaline. What are each one features? What are the functions and what is the matters here? We are observing from this slide. Bile is made in the liver and stored in the gallbladder, which helps in the all these functions we have seen. That is of digestion in the also observations and excretions component, and it's also has the compositions of bile salt and other things and the bilirubin secretions. All are needed for the digestion purposes. Each cycle, that is of Hebb cycle, and in biochemistry you will be learning that about the heptatic cycle and for all the cycles here. In second semester you will be learning deeper in the Hebb cycle. In that you will be understanding how the fats, carbohydrates, protein, vitamins, minerals are digested. The bile has some pigments. In that pigments, what are the five important functions of detoxifications and maintaining of antioxidants and immunifying the fats and giving the colors to the each of yellow, brown, all to the feces and urine to detect its abnormal condition, to which is of indication for the bile duct and the liver health. To conclude, bile is a golden fluid with a multiple function, digestion, absorptions and excretions and pH regulations and infection control. Any disturbance in the bile flow can lead to jaundice, malabsorptions and gallstone diseases. As a nursing students, always remember to assess the jaundice, that is yellow sclera, dark urine, pale stool, to monitor the LFS and give proper digestion advice. Reference. Thank you for watching Yes Assessment. You like, share and comment. Thank you.